Hi, lovely people. October is here, and everybody knows that October is Breast Cancer Awareness Month. And we know that breast cancer is the second leading cancer that affects a lot of women and can lead to death. So, MSTV Health Cancer section is bringing you a whole month of October breast cancer awareness and also a breast cancer screening day. Watch out for the dates and details on our breast cancer screening day. But follow us on all our social media platforms to get the insights and know more about breast cancer. What is breast cancer and what breast cancer can do to a lot of women? Watch out for the details on MSTV. Bye.
Maino, Master Planner Farikaka. Maya Gambaran Hausa, Gamlatia Gambaran Hausa, Asashin Hausa, Maya Gambaran Hausa, Gamlatia Gambaran Hausa, Asashin Hausa, Maya Gambaran Hausa, Gamlatia Gambaran Hausa, Asashin Hausa, Maya Gambaran Hausa, Gamlatia Gambaran Hausa, Asashin Hausa. Farko mu yi wasa yanzu mu zage dante punchlines da sanani kamar wasa dambe Amerika Allah bani gani za a zarge aske maganin duhu a fito fage yanda aka dama aka zasa yasa kowa ya zo ya bibi nasa game da matasa barawo mai sallama sabon shiga miyagun maganganu yaro sai ka daina fada farin kaka nake mai sinsin goma zane jaga da ke mai yagagen riga in takawa ka yi to mun fita yau zagan bambanci kaso nima da malata wakan ka fikira ne a wuri na comedy a zo ai karo da goshin jirgi tragedy tura ta kai bango ta sani ya fito fili gurgusa ka ban wuri abokan safi gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa maye gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa maye gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa maye gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa. Assalamu alaikum ga sanarwa ta biyu baya jarraba ko da gagareren matsala muka so magambaran Hausa kena ka balula zana yi bayani kan waya ku ban salula 1998 muka so magambari true preachers da Hausa jamboree mu da gambaran Hausa kaman baki da lebo mu so ma waka tintini with you eligible at your pen what I spit is in I am the true preacher rapper Smith is Jim na so ma tintini yasa nake alfari in zaka zo da rigima sai sa makamari on net lyricist da Hausa rap mogul ni ba ka fahimta ba je ka fada cikin lagu bani matlago ba sala kuma ma voye akwaswala tia voye mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran Hausa gwamnati ya gambaran Hausa a sashin Hausa mai gambaran.
Come to mind. Okay. All right. Thank you very much. Your cancer there. Hello, viewers. Welcome again to another section of Health Cancer on MSTV GH. We are bringing you a new exciting edition on Health Cancer. Today we are going to talk about cancer, the cancer of the breast. And I have with me in the studios Munira Yakubu, a nursing officer. Welcome, Hajia and Munira.
Thank you very much.
How are you?
Alhamdulillah, I'm fine.
You're looking very, very beautiful.
Thank you. You too.
Oh, thank you very much. I'm blushing. Today I want us to talk about cancer. Okay. Before we talk about breast cancer, I want you to tell me what you know about cancer. To a layman, when the person hears cancer, what should come to mind?
Okay. All right. Thank you very much. And good afternoon to our viewers. Okay. Cancer in in a sense, is multiplication of abnormal cells in any part of the body. It can occur in any part of the body. Think of any organ and you know that there could be a cancer there. Yeah, so that's basically what cancer is.
So we can get cancer in any part of the body.
Yes.
Wow.
Yeah.
Wow. Yes. We heard that the number one killer of women, that is breast cancer, aside lung cancer. Today we've chosen to talk about breast cancer since we are in the pink month.
Yes.
October is a whole lot of pink month.
Yeah.
So today we are talking about breast cancer and making breast cancer awareness for all people watching us. So today I want you to tell me about what breast cancer is.
Okay. Breast cancer is a cancer of the breast, meaning there is some abnormal cell in there that is cancerous. Okay. And that cancer, you're in the month of awareness month, which is October, and that's why we are creating more awareness, because a lot of women are dying because of cancer. And it's not because of the cancer that they are dying, but because they don't detect it early enough to come to the hospital. And we are involving more women because even though cancer affects males as well, if you should have about 100 people, you can only have 1 or 2 males being affected with breast cancer.
Right. 2 out of 100?
Yes.
Yes. Then it's somewhat way we can say it's a women's sickness, but just that we have a small, minute percentage.
Exactly.
Sister, my young country, why?
Let me show you. Okay, breast cancer, nufomu kukram. Kukrama ewo nufomu. And see, kukramu no, to me, affect your body, like when you bone, baby, by a car breast cancer, natural say kukrama, edanufum.
Okay.
Na kukramna, edanufum, affect embema, any emba, but emba, anna, edum. To say, nipa be 100. Nipa mienu bi mbema mienu pe ene betumi enya. Yes, nti do ye screen a yetumi screen mbema no, but ye focus ewo mba no so because omo mana nenya jojo na nenya breast cancer. Yeah.
This is interesting. This is getting really, really interesting. Hajamuniwa, please, I want you to tell me what are the causes of breast cancer. What causes? Can you just be there and then you just develop breast cancer, or there's some things that you do, or there are some things that causes breast cancer?
Okay. The main cause of breast cancer or any other cancer is not known. No research has proven that this or that causes cancer. Okay, but there are risk factors. Okay. So when it comes to breast cancer, once you're a woman, you're at risk of getting breast cancer. That is why we encourage everybody to go and screen. Once you're a woman, you're at risk of getting it. Then family history.
Okay, so the risk factors are, some of them are like the family history.
Yes. So the risk factor is being a woman. It's a risk factor. Yes.
Wow.
Be a family history. Supposing your mom has had breast cancer or anybody in the family has had it, yes, you should be aware of it. Okay. And so then you'd be checking yourself from time to time so that you can prevent it or avoid going into a stage where you can't treat it at all. And your age. As you advance with age, you could be at risk of getting breast cancer. Okay. Yes. Another one is contraceptives.
If you take a lot of contraceptives.
Yes, especially the emergency contraceptives. Once you're taking it without prescription and you're just taking it anyhow, you're at risk of getting it.
Okay.
Another one is obesity.
When you are fat.
You are at
it
risk.
Doesn't mean all fat people. But
When you are it's just fat. Like you being a woman. you are at
Okay,
risk of getting it. If you are
Obese
bigger than
too.
your size, maybe you go to the hospital to check your BMI, yeah, and that's checking your height versus your weight.
Yeah.
Then when we equate it, when you get a certain value, you
Which
are
is
probably
high.
overweight or you are getting to the obesity side. You're at risk of getting breast cancer. Then another one, smoking. If you smoke a lot, as a woman, you're at risk.
Wow.
If you drink a lot, you are at risk.
Okay.
Yes. If you menstruate too early to...
The too early is it too early within the 28 days?
No.
When your period comes?
In terms of your age.
Okay.
If you before... Obenya or menses now we debate 13, 14, 15. So say, as young as 7.
Yeah.
Yeah, so
it's another
exactly. It's another risk.
Wow. Yes. This is getting really, really interesting. But let's switch back to a little bit of Hausa. Salamu alaikum yawayimu. Yau muna batun breast cancer. Breast cancer ga ya zama ciwon da ke damun mata sosai a cikin zangonnin mu. Yau ni da Hajiya Munira ne cikin studion MSTVGH muke batun breast cancer. To ta bari mun gane kaman akwai cancer daban-daban da ke affect mata, amma breast cancer nan ya zama wanda ke affect mata sosai, kamar aka tara mutane kamar 100 kenan, an ya samu maza biyu kade da suke da breast cancer, amma sauran duka ya zama mata. Isa mu ne aka mata mu duba kanmu da kyau. To ainihin abin da ke kawo breast cancer da kanshi kuma ba sani ba, kamar cancer da kanshi, abin da ke kawo cancer da kanshi dai ba iya an gane ba har yanzu, amma akwai abubuwan da ke gwada kamar in ka duba kanka za ka yi ka samu wannan breast cancer. Akwai wani abubuwa da muke ce kamar risk factor, kamar kai da ka zama na mace ka yi ka samu breast cancer easily, ba da wuya ba. Kai da kake smoke, kai da kake iyayenka ko wani cikin familinka ya taba samun breast cancer, kuma wannan kuma aka mata ka duba kanka ka fara kiyaye kanka daga samun breast cancer. Kai da kuma kake shan maganin contraceptive ga da ake sha da ba su a doki ciki da sauran abubuwan ga, kuma kana da risk da ke samun breast cancer. So we switch back to what we are saying, Hajiya. So I want to know the symptoms. Okay. No, before the symptoms, let's talk about the types. I want to know the types. Okay. I know there are types, right?
Yeah.
And maybe stages of breast cancer.
Okay. We have types. First of all, when we talk about cancers, we have benign and malignant. Okay. When it's benign, that means it's non-cancerous. It's not cancerous. Okay. But when it's malignant, that means there's cancer in it. And when it still is malignant, some can move from one place to the other. Some too are just at one point. And when we talk about stages, we have 4 stages in every cancer. Stage 1, stage 2, stage 3, and stage 4. Okay. When a cancer is at its first stage to second stage, it's manageable and be treated.
Okay, so it's not that serious.
It's
the
not,
first and second stage.
Though you go through all the hassles in treating yourself, your survival rate is very high.
Okay.
Very, very high.
Stage 1 and stage 2.
Exactly.
Okay.
But when it hits stage 3 and 4, subhanallah, that's where the problem is. So I'll take you back to early detection of any cancer is key. So if it's at like early stages, you can come to the hospital. We'll detect whether it's cancerous or not cancerous. If it's cancerous, there could be a lump there and it's not cancerous, we'll take it out. Okay. And if you have to undergo some other treatment, you do it and you are safe. But if it's cancerous, we still will take it out and you do some radiations and some chemotherapy. Radiation is using X-ray in treating radiation in treating. Yes, that's cancer.
Light,
exactly.
lasers,
exactly.
Cancer.
But when it's chemo, you use drugs that you take.
Okay.
You know.
So you go under chemotherapy.
Exactly. Yes.
Okay, drug therapy.
Yes.
Then
So
you said there are 3. I thought you said radiation.
Surgery.
Okay, they said.
Yes, the surgery is the taking out of the lump.
Okay.
Or it depends on the stage and what it is. If it's actually surgery, if it's just a lump, they just do some small incision, then they take it out. But if it has advanced, they may have to take the whole breast. Okay, and breast cancer, it can affect just the duct of your breast. There's things in your breast, and some part of it is called the duct.
You wait, I think.
Okay.
It's getting interesting, but I think we are moving a little bit.
Okay.
I want us to talk about how do I determine that I have breast cancer as having maybe the early stages of breast cancer.
Okay. Sometimes you could have a cancer in your breast and you wouldn't have any symptoms. Yes, it's very possible. That is why you still have to, go through. You should make it a habit of going to the hospital to be checking yourself from time to time, so that if there's anything, they can detect it. Because you wouldn't have any sign. But if you're going to have any sign and symptoms, sometimes the lump is a very common way of detecting breast cancer. Or maybe you squeeze your nipple and there's fluid coming out. It could be clear or cloudy or bloody.
Nipples, blood coming out.
Yes.
There are people who have experienced
Yes.
Okay.
A fluid coming out of it. Or maybe your nipple has gone inside. Okay. Or maybe the normal size of your breast has increased. If you know the normal size of your breast and it's becoming big or bigger
all
than
of a sudden.
Exactly.
Okay.
Yes. So there can be a swelling somewhere.
Okay.
Yes. So those are
fine.
Exactly. And sometimes too, you can maybe have nausea and vomiting.
As a sign of a breast.
Like it's just one of it.
Oh, okay.
It's not every nausea and vomiting that is associated with it, but
if
you
have an unexplained nausea
and
or
vomiting, exactly,
you should examine your breast. Okay, early examination is the best, right?
Exactly.
So, what are the ways we can prevent ourselves from getting breast cancer?
Okay, prevention of breast cancer. The first and foremost is breast examination. Okay, you should, as a woman, you should know the size of your breast. Sometimes, usually, one is bigger than the other. So you should know which one is bigger than the other. So that when the one that is smaller is also getting big, you would know.
No, okay.
Or the one that is big is getting too big, you would know.
Okay.
You should know how it's positioned, how your nipple is. So that when you examine and you see something
that changes,
you know, then you report to the clinic, then we can do further examination.
Okay.
So before we end everything, I would like to demonstrate or teach how to do the breast examination.
Self-examination.
Exactly.
Okay. Yeah. We'll also have a chat on our channel for you to also see how it's being done.
Yes. So that's the self-examination is one way of preventing breast cancer.
Okay.
The second one, we talk about risk factors.
Yes.
So if you know something is a risk factor, then you have to avoid it.
Yes. So you should examine
exactly.
yourself.
So if you smoke,
you have to
stop smoking. If you drink, you should stop drinking. If you're obese, like obesity, you should
try to reduce weight and exercise.
More of exercise, eat well, more balanced diet. Don't eat gari morning, afternoon, evening. At least balance your diet. Okay. And those are ways of preventing it.
Okay.
Yes. And contraceptive. If you are fond of taking a lot of contraceptives that are unprescribed, you haven't gone to the hospital for a prescribed contraceptive. Don't go in for emergency contraceptive just like that, because you're putting yourself at risk. Yes.
So too much of the contraceptive.
Exactly. And family history. If you know that your mom or somebody in your family has breast, you should make it a conscious effort to be examining yourself or even come to the hospital so that we examine you to, see.
See that.
Yes. And
Okay.
I think I talked about
So you wanted to talk about the breast
breast
examination.
examination. Yeah, I'll bring that in. But I was going to talk about mammogram, and
Okay.
that's also another preventive measure.
measure.
If you are above 40, you should do a mammogram. If you do the first one every year, you should do it so that in case there's something in there, they can detect it early and treat it.
Okay.
Yes. So.
Oh wow, this is very, very interesting.
Yes.
Are you ready to listen to how to self-examine your breast yourself? Do it yourself. And if you're not comfortable, you can go to any hospital around you. It's actually free. You can go. This is the Breast Cancer Awareness Month. Any hospital or any facility you work with, you can just walk in and have your breast examined. But you can also do it in the house.
Yes.
Aja Munira, talk to us. Okay. How do we do it?
Okay. It's very simple. Okay. Before you do a breast examination, make sure that you're done with your menses.
Okay.
That's the first thing. Why? Because when you are menstruating, your hormones pile up in a way or changes in a way that can make your breast feel firmer than or lumpier than usual. So you may not be able to tell. So after menstruating, maybe 3 to 5 days after your menses, you do the breast examination. Okay, so that you can feel the natural texture of it. So all you need is a mirror, or a bed where you can probably lie, or if you want to sit, you can sit and examine. Okay,
so, but you need a mirror.
Yes.
Okay.
You need a mirror. Why? Because you need to look at the size, the shape, the color
of your breast.
Yes. I think there was something I even forgot. Discoloration of the breast.
Okay.
Maybe your breast is all fair and all of a sudden
it started becoming black.
Exactly.
It's also be worried about
exactly. That's why you should know how your breast looks like. The shape and everything.
And the men too, they can examine for their wives, right?
Oh yes.
They know how. They should know how their breasts look like.
Yeah. You are looking for trouble.
No, there's no trouble. I think some of the men will help their women out. If they see changes, like maybe this is not the breast I usually see every day.
You know, why I'm saying you're looking for trouble is there's something going around social media that suck a breast.
I want to come to that. Yes, we'll come to that. There's a suck a breast and say.
I want to chip in something there.
Yeah.
Because suck a breast and save a life. It doesn't mean you should just go and suck. They want you to know how to do breast examination.
Not just sucking.
No.
Oh, okay.
When you're sucking, you're massaging, you're seeing, you should know how your wife's breast looks like, and so when there's a lump in there, you can detect it and help her, get early treatment. So that's the idea.
It's not just about sucking. It's about examining how the breast is.
Yes.
Interesting.
Exactly. So can we dive into the main? Okay. So you get a mirror. You sit or stand in front of the mirror. Then you raise your hands. Okay. That is to determine the size of your breast, how it looks like, if there's something protruding or not protruding. Because some of the lumps, when you raise your hand, you can see that maybe a beshaho baby. You get it. So you can tell. Because the breast isn't what we see here. It starts from somewhere under the armpit. Because some of the lumps can go under the armpit.
So when you examine yourself, maybe it has already run to that side.
Exactly. So you have to start from under your armpit, coming down, then around the breast. So you first look at how it looks like, the size, the shape, if there's any indentation.
No discoloration.
No discoloration. Then you press the nipple to see if there's any discharge coming out.
If you're not breastfeeding, there shouldn't be anything.
If you're not breastfeeding, nothing of that sort should come.
Wow.
Okay. But you should know that if there's a fluid coming, sometimes it's not conscious. But it could be some hormone or something. You just need to go to the doctor. They would examine you further and detect whatever it is. Then you get treatment. So after pressing the nipple to see if there's any fluid coming out of it, if there's no fluid, nothing to be worried about. If there's fluid, then you have to report to the hospital. If after raising your hand, you see something protruding, like as a lump be you can see obviously, you should further examine and report to the hospital.
Okay.
So after that inspection, you raise. If you are lying down, you put one hand at the back of your head.
Okay.
Okay. But if you are even when you are sitting, you can still put
your hand
exactly while you're looking in the mirror or probably lying down. Then you start from like somewhere under your armpit.
Okay.
Then you go softly around it.
Okay.
Okay. Then after doing softly around it, you go deeper the same way from that armpit side, then around it. Then you come inside the side, that place too, you press, because some of the lumps can be hidden.
Okay.
Okay. And when you hold your breast, the lump inside your breast is just one. It being shifting baby eye. So sometimes, if there's a lump, it can be separated from the main breast.
Okay.
And see, you have to make sure that there's exactly well. There shouldn't be anything separated from the main thing.
Okay.
Then you press around the black side.
Yes,
around the nipple. Exactly, okay. That side too, and see if there's any lump there.
Okay.
After that, you do the same thing to the other side.
Wow,
yes.
Interesting.
Yes. So
it looks quite easier. Everyone can do it for his or herself, or the husband can do it for the wife too. Okay, so this is really, really interesting. But I want you to sum whatever you said a little bit up in tree for us.
Okay, we can. Okay, about the breast examination.
Yes, please.
Okay, it's here for na me sure na yebe examine ye nufo. Sena bibi ewo mu a ubehu nentem na wakako doctor na nurse bi ne wa examine we no wa show we say ampa cancer na say enye cancer. Okay, first of all, the answer na obeye no obehia mirror. Okay, after mirror no so obehia empa mpa nso a obenya akonja na obetumi gina honum na wahwe nti ugina mirror ni mu a obepagya wonsa o hwe se na onufo no ne kese ete.
Okay.
Ni mienu nyina to de bia ba ko so same ba ko naturally. There's nothing wrong about it. So you should ese wonhu nufo no na emudie dru emudie saying the emunye dru no nti uyasa ubehwe se ni nyina pepepe a se na unim ne na se changes bia be mu a ese o report but upeja wonsa na o hwe size no area na wahwe se na color netie cause to the bia maybe unufo no kokko na maybe ehun ye tuntum and also is a sign ese o report mo hwe se wonipo na unufo na no akum ana akru bi aba ho ana say rashes bi aba ho ana mo hwe saade ni nyina area na ode wonsa ba ko ato wonsa echi sa woda ho a obetimi de wonsa hye kon echi the opposite one ujina honsa stella obetimi aye the same thing enti wo yesa na wode say left side na wo hwe wode right no
okay
ebe best fi wa mutu mu ase hono kakra no hono ube mi kakra softly uwie uko round wasai mia no deeply like ebe komu kakra na wo hwe say maybe lamp bi ana say ababi edemu ideally no onufo no ne lamp wo mu na ye ba ko enye nketen usomu a kese ba ko but lamp bedema wanhwa na ewo amochi mu ase anasa wonufo no ate ne hu eda baby ese mu hu until you go round the breast mia na ode wonsa for you say no o separate na you can't feel it until a 4 no say na you can really go around it while you feel it. Until you go around it, then you come in the middle, you come to the nipple side, and now baby a black one. Honso na we mia ahwe say ubenya lamp bi wo mu a ababi ede mu a nti wie that particular one you do the same the same thing for the opposite side.
Wow, interesting. This is very, very, very interesting. You can only get this at MSTV Health Kana. It has been an exciting edition of breast cancer. Wow, Hajia Munira, I've really, really, really learned a lot. What would be your final words to the viewers?
Okay. Okay, so my final words to the viewers is that this month of October, it's a month of creating awareness for breast cancer. And there's a lot of noise going around for you coming to the hospital to screen, come to screen. Bear in mind, it's not only in October that we get that free screening in the hospitals or anywhere else. Even when it's not October, come to the hospital. Be examining yourself every month. After your menses, you examine yourself. Know how your breast looks like, the size looks like, the texture looks like, the color looks like, so that in case you do the self-examination after every menstrual cycle, you know if there's something going wrong or it's intact, so that you come to the hospital, we do further examination and we treat. If you come to the hospital after the second stage, like I explained earlier, it will be too late to save your life.
That's true.
And your life matters to us. Even one person dying is like a loss to the country. So women, let's encourage each other. Let's stop the stigmatization. If somebody has breast cancer, doesn't mean that that's the end of the person's life. No, come to the hospital and save your life.
Thank you. Before we let Aja Munira leave here, we want you to talk about breast cancer in men. Is it the same symptoms, the same risks, the same prevention, the same causes, or they are different?
No. Once it's cancer, it's cancer. A male's breast may be smaller than a female, but bear in mind, it doesn't matter the size. As small as it is, you can still get men with cancer with it.
So they also develop lumps?
Yes. So symptoms, preventive, risk factors, everything is the same. Exactly. The way we do the examination, they also have to do the same. Yes.
Okay.
Yes.
So my men outside, I hope you've heard everything from Hajia Munira. This has been a very interesting discussion, another interesting section. This is where time will permit us to roll off the curtains. Kindly follow all our social media platforms, MSTVGH, and our website, www.mstvgh.com. Thank you to our producers. And if you want to sponsor this program, kindly contact MSTVGH on all our social media platforms. And not forgetting, we are coming out with a very big mass screening for women and men. Since the men are inclusive, you're trying to add them to it. So men and women, watch out for the flyers on our screens and follow all our social media platforms. This is Health Kana on MSTVGH. Bye.
Hi, lovely people. October is here, and everybody knows that October is Breast Cancer Awareness Month. And we know that breast cancer is the second leading cancer that affects a lot of women and can lead to death. So MSTV Health Cancer section is bringing you a whole month of October breast cancer awareness and also a breast cancer screening day. Watch out for the dates and details on our breast cancer screening day. But follow us on all our social media platforms to get the insights and know more about breast cancer. What is breast cancer and what breast cancer can do to a lot of women. Watch out for the details on MSTV. Bye.